Okay, to the left here, I have the awesome registered nurse Connie Allison. Connie, welcome to the show. Make sure you
Thank
speak
you.
into that mic for me, though. Okay.
Yes, sir. Got it.
We had you on a few weeks ago?
Yeah.
About a month ago, and we were talking all these medical things, supplies, and we were talking again how we wanted to blend that into my concepts of not my concepts, but what I've always talked about: bug out body, bug out bag, bug out vehicle. And just to clarify, ladies and gentlemen,
Just want to let her have that one because that one's not.
all right, we're gonna move mics around because something's not working here. Okay. That doesn't look pretty though, Trey. Okay, we'll make it work.
Yeah.
Okay, the bug out body is the essentials that you would need on yourself that I would think you'd want to carry on yourself on a daily basis, just in case something happens. Like if you got a medical problem, you want to have some type of medicine to cover it. But to give you an example, what I'm talking about, a bug out body. When I'm walking around, I've got money, I got my phone, I got a couple knives on me. If I'm allowed to carry my weapon, I'll carry my weapon. And anything else that pertains to me, credit card, phone numbers that I might need down the road that are not in the phone but on paper. Is there anything, Connie, how do you want to start this? Do you want to just go starting with the body and then move on and talk about the things that you feel are important to have, necessary to have?
Sure. Yeah. So, I always tell everybody, like, you want to customize it for yourself, right? Especially for your body, that's for you. Now, if you have a child, you're responsible for the child as well. So if you're a parent, then yourself is an extension of your child. But mostly yourself. If you have specific medical conditions, like if you have a severe allergy to something and you want your EpiPen on you. You want, if you're diabetic, you want to have anything, most likely glucose, right? That's going to be the most immediate thing that's a danger to you.
Can you explain what those are? Some people might need certain things. For example, like the EpiPen, I know there's alternatives to it. Maybe somebody hasn't actually gone to a doctor and got a prescription of getting one of those, and they can use something that works for them. Bee stings is a good example.
Right.
Is there any, what are these terms that you're saying? What do they mean? So somebody may say, oh, I didn't even know about that.
Yeah, so epinephrine is the medication used to treat severe allergic reactions like anaphylaxis. So if you have it, you'll know. It's not something, but you can become allergic to anything at any time. So that you could have an anaphylactic reaction to something that you've been exposed to in the past. You can have an anaphylactic reaction to something because you've never been exposed to it. Some of the most common and severe are latex allergies, peanut allergies, generalized nuts in general are usually pretty severe. Those are the ones where your airway swells, different foods, bees.
I know I got stung by a bee and my face, hands swelled up. I was like, oh my gosh, I can feel the restrictions already.
Right. So some people, it's just enough of an allergy that you break out in hives and you can take some Benadryl and then you're fine. Some people, it's very quick and it causes swelling in your airway. If your airway swells, closed and you can't breathe. So what they use to treat that is an epinephrine. So at the hospital, we have it in vials. We draw it up. We know the dose and all that. But normal person's not going to know the dose. So they have EpiPens, and they're auto injectors, which means they're spring loaded. You can inject them right through your clothes. You go right in the middle of your thigh, and you slam it down, and you hold it for 10 seconds. And that spring loaded needle injects. It's preloaded with the right amount of medicine, and it just automatically delivers it. It works very quickly.
Can somebody get it just for general purpose? Because you
have to get a prescription.
Okay, but you just said that you could all of a sudden become allergic to something.
Right.
Could somebody just get one to have it on standby?
Like to have it in their bag? Sure, you could talk to your doctor about that. It's not a controlled substance. It's not something that they're going to be like, oh, we're going to go and sell that on the street. Or it's for a medical emergency. So, it's life-saving. Now they're making like insulin for diabetics. That you can get that without a prescription. You can go to a pharmacy and buy it. So they're kind of moving towards the life-saving stuff without having to have prescriptions because people aren't always able to get prescriptions and see a doctor, but they need those things.
What would be an equivalent to the EpiPen? Like I mentioned, I use Benadryl for me. Some people say the strips are better, the liquid's better, the pills are okay as long as they're the capsulated form. So is there any difference to that?
If you have an allergic reaction to where your airway is swelling, an oral medication is not gonna hurt you. I would try whatever I had, and I would probably take Benadryl with my EpiPen, and because that kind of works on a different level as well. So you can do Benadryl. A lot of people don't know, like your gastric medicines, like Pepcid, there's a lot of the generic forms, which are always cheaper versions, like omeprazole, famotidine. So like any of your antacid medicines are a different class of histamine blockers, which is what Benadryl is a histamine blocker. There's class 1 and 2. We don't need to get into all of that, but they work as well. So we give those medicines for allergic reactions. So you can take Benadryl, famotidine, Zyrtec.
The reason I'm asking
all
that
that
is
together.
because a guy most likely doesn't have a purse. Okay, most guys don't carry purses. They carry a wallet in their pants pockets and all that kind of stuff. A woman, however, because you made the comment about children, usually the children are with the women usually.
Right.
And usually a woman usually has a purse, so she can probably
Right.
store a lot more stuff in there. So
Right.
we want to streamline it for a gentleman or anybody who doesn't carry a purse and they just have the clothes on their backs and pockets. The EpiPen comes in a little case from what I remember.
Yeah, it's pretty big.
So it's
They're
awkward to carry.
right. I think you can get a prescription to get the vials too, which are smaller. But of course, then you need the needle and you need to be able to draw up. You can have this all calculated so that it's like in a laminated card or something you keep in your wallet, so you know exactly how much. Or even I've seen where you can draw a line on the syringe. You're like, I pull up
Yeah,
this
right.
much, so it's dummy proof. You know what I mean?
And now-
This syringe is for this medicine, and this is how far I need to pull it up.
Now, we're saying this because we're talking about the bug-out body.
Right.
When we get to the bug-out bag, then we can talk about different things. But right now, we got to streamline it. We're working every day, doing our thing every day. We got to carry our supplies with us. That's immediate supplies to get us to our bug-out bags.
Right.
So when we're talking about the alternatives for your EpiPen, and it is the Benadryl or whatever, you can get them in capsule forms that maybe you can put in your pocket and stuff like that.
Can
Okay?
I ask,
Yeah, go ahead.
What about alternatives for like rescue inhalers?
Really, I mean, as far as like those are bronchodilators. Those open up your airways. There's not really any substitute for that. I mean, you have to get the medication. I mean, for that medicine, there's nothing over the counter that's equivalent. Yeah. I mean, the Benadryl and stuff, that'll help get rid of the allergic reaction. So if you're having wheezing in your lungs from that will help with that. Now, the oral medication is not as fast acting as IV. Also, steroids. If you have you can get a prescription for some oral steroids. If you have allergies like that, that would be something I would want to keep in my bag. So I have allergies.
So what does a steroid actually do? What's it doing to you? Because I know I've
It
taken
reduces
steroid.
inflammation.
It can make you alter your states of mind, can it?
Some people are very sensitive to it. It can make some people very agitated.
Yeah, that's kind of what happened to
Roid
me.
rage.
You get it's different than like anabolic steroids, like for muscle, like for bodybuilders and stuff like that. Some people, it makes me feel great. I have energized. It will give you more energy. Your body naturally produces steroids in the morning. So if you're on steroids, they tell you take it in the morning because it can keep you up at night, keep you from sleeping. But if you are sensitive to it, or if maybe your body's naturally, steroid level is already high and you're on more steroids. Some people get really agitated. Some people feel like they're very anxious and will be very snappy, to put it nicely.
I'm laughing because that
it's-
sounds familiar.
Yeah, it's not just you. That's a very common side effect.
Okay, time's ticking. So let's move on from the bug-out body to our next step would be the bug-out bag.
Okay.
And I've got mine here. I want to show it because you'll be seeing this on the video probably Tuesday or so. But this is my bug-out bag, and I'm going to try and describe it to you. I try to keep the bag narrower than my shoulders, and I try to keep it as flat and close to my back as possible. I don't want this big monstrosity of a thing sticking way out because then it causes the weight balance on your body to be awkward. So I like to keep it what they call light and tight. Just put in there what I need, keep it light, compress it down, and all that. And what I did also, Connie, we were talking about this. I drew a diagram of my bug-out bag to illustrate it here on the show. And what I did was I drew it from the front view, and when you see the video, you'll see the highlighted mark is the middle pouch. And then the next diagram shows it on the side. And once again, there's the highlighted mark, the middle pouch. And then the last diagram was to the rear of the pouch. What's very important is to have a list of what you have in your bag so that you're not saying, oh, I don't know if I've got it or not. You may have to search for it, but you won't have to if you write it down properly, which we were talking about now. So let's intertwine what you think is important to have in a bug-out bag. And then we can basically say, based on the pouch, for example, let me give you one example. here's a list of what I have in my bag. The front top pouch, it's my quick access stuff. iPhone accessories, battery pack, dental floss, ibuprofen, Q-tips, Benadryl strips for the reasons we just mentioned. And I got a water faucet adapter in case I'm needing water. There's plenty of buildings around with faucets, but they don't have the handles on them because I don't want people tapping into it. But if I need some water, I've got an adapter for it. So it just tells me where it's at and what I've got. So Connie, what kind of things in a medical sense, since we have a little bit more room, would you want to carry?
Well, first of all, I would laminate your list, because if that's what you're going to be looking at, like, you know what's in your bag, you know what's in there, but in an emergency situation or a situation where you need something quick, your brain kind of shuts off and it goes back to basic instincts, and you don't want to pull your list out and it's soaking wet and you're screwed because you have no idea where the thing is you need.
Right.
So laminate it, and it's cheap, it's easy, doesn't take very long, and it will solve a lot of problems. Second of all, I would keep my tourniquet somewhere, like probably tied to my bag, because that's probably the number one thing that will kill you.
You made a big issue out of that last time, having the tourniquet. Yeah.
Right. And, I mean, knowing how to use it and when to use it is very important as well. But that, and then probably quick clot dressing and knowing how to use that. A lot of people misuse that.
Clarify a quick clot dressing.
So you can actually buy it at Walmart, and you can buy it at Academy. You can order it online. There's a lot of like tactical stores that sell it. It's military based. They have a bunch of different brands. Quick Clot is just one of them. Basically, it's a hemostatic dressing that has a chemical in it that reacts with your blood to clot.
Is it like cauterizing, heating up?
It does get hot. So if you use it correctly, you will feel it get hot. If it's good, you know.
And when would you recommend the use of that type of thing? A major cut, a gunshot wound?
Right. So if you have... So, like, for example, I've seen people that were breaking into something, or for some reason put their arm through glass, and it just kind of shreds you and cuts up all over. Those are not always something you can get direct pressure on everything, right? So you put this quick clot dressing and you hold it, and the technique for it is thumb over thumb. So you put thumb into a wound. So say you have your arm here and you have a cut. You want to get the dressing, and sometimes it's in a strip, sometimes it's like a little hacky sack. Do not open the hacky sack and pour the powder into the wound. That's terrible. Don't do that. But you take the strip and you literally stick it in there. You fold it over, stick it in, thumb over thumb, and you hold it. This is how you hold direct pressure. Some people want to do this. You're not doing anything.
She's demonstrating. It'll be in the video come Tuesday.
When you put your palm flat over something, that's not effective. Better than nothing, I suppose, but it's not going to do anything. You want to put your thumb directly to where you see the most bleeding coming from. There might be blood all over his arm, but this is where I see the blood coming from. Thumb over thumb, and you just keep putting that dressing a few times, and then you hold it. That quick clot dressing, you'll hold for like a minute, 45 seconds to a minute on there, and you will feel it start getting hot. That is supposed to do that. That's the chemical reaction. Okay. But you can get them all over the place, and I would recommend having something like that in your bag, because that's just going to buy you time to get somewhere.
And the other essentials of life would be water. You were talking about this
exactly.
as well.
Water. There's like the Life Straw. Mm-hmm. I've never personally used one, but I think they're awesome. It's basically a straw that has a filtration built into it. You can drink out of a pond.
It's not meant for high volume. It's meant for portability.
Right.
And emergency aspects, so you have something like you could drink out of puddles, ponds,
yeah,
swamp water, something.
Yeah.
Then we got fire, heat, warmth, right? We want to have some of those things.
Mm-hmm.
But is there any other key elements within the confines of a bug out bag that we may not be thinking about? You got the tourniquet, you've got medications. Anything else we're missing?
I would have like plastic sheeting or plastic bags or something like that. There's a lot of different things like that you can use for multiple different things and kind of make into something else that you want.
Clarify, because you can use that plastic for sucking chest wounds.
Right.
Why don't you explain to people again the concept of a sucking chest wound and why the plastic is important for that aspect?
Right. So you have a sucking chest wound, if you don't know, is like if you have penetrating trauma, like if you get stabbed or shot in your chest, and basically air is coming through the hole into your chest where it's filling around your lung. So air's not supposed to go around your lung. So when it does, it causes your lung to collapse. If it's collapsed, then you don't get air in, which is not good. So basically, you want to stop that immediately. That's the first thing that you can do. You want to put your hand over it, something that's going to seal it, but you can't sit there with your hand over it all day.
We got a hole here. Now we're not putting our thumb over
No.
the thumb. We're putting our palm on there to cover
This
it up.
is to seal air from going through. This is not to stop the bleeding.
Okay.
If you want bleeding, you want direct thumb pressure. Because think about it, if you have a vessel that's bleeding, especially if it's arterial, that's not easy to close off. Our arteries are big and they're very thick walled. You have to put a lot more pressure to collapse that. Mm-hmm. Like, think about trying to kink a really thick water hose.
Plus, you got a lot more pressure coming on the back side of that, right?
Right. You have a lot of pressure inside it. That's why they're so thick, is because they have to handle that pressure.
Mm-hmm.
Your veins is going to trickle, and it's a lot easier. You could probably stop venous blood like this squeezing, but if it's arterial, which means you will see spurting, you're going to need direct concentrated pressure over that artery.
Okay.
But as far as the chest wound, you want something that's going to seal it. So your hand will not seal all the way, but it will help. But if you have plastic, what you want to do is basically you're making a valve. So you put the plastic over the wound and you tape 3 of the sides. So you want the air to be able to come out, but not to come back in.
Right.
Yeah. So you'll put the plastic tight, take 3 sides of it, so that whenever you take a breath and your lungs work off negative pressure, right? When you take a breath, air will go into your lungs, but not into the wound, because that plastic's going to suck tight to it. And then when you breathe out, or when you breathe in, the air is going to be pushed out of that, and it'll.
Gotcha.
It's like a whoopee cushion.
Okay, sounds good. It's gonna make noise too.
Possibly. Yeah,
All
you'll
right.
hear it.
I got about 2 minutes left here. Let's go to the vehicle now. And is there anything that you say, hey, I can just keep it in my car. I don't have to worry about it. But man, it's nice to have it, just in case.
Is on the medical aspect of that, like you said, EpiPens are kind of hard to carry, but you can carry those in your bag. I would have more supplies for, like, if you need like shelter. Really, if you're going to have anything like a tent in your trunk, or anything like that, I would have
Any type of machinery that you could plug into your cigarette lighter that might help you, like something to help your breathing.
right.
Nebulizer.
So if you have asthma,
Nebulizer.
Yeah.
I was gonna say, if you have asthma, you can have a nebulizer machine, and you can probably get one of those adapters that will convert to a car. And a lot of cars now have the plugs in them, or USB ports or anything like that. So if you have asthma, that would be a great thing to have in there.
What about this? What about with the technology age that we're in? Is there anything we can utilize in that aspect to help save us with doctors, hospitals, communication-wise?
Yeah, you can get basically like on your phone, you can get databases of stuff that has medications, what they're used for. You can look up symptoms and how to treat them, all that kind of stuff. So you get that on your cell phone though.
So if somebody was to come and do first aid on you, let's say some EMT, and they have something on you, maybe a wrist bracelet or your name, they pull up the name, and there's your history, and they can say,
Well, on your phone, so a lot of people wear alert bracelets, which just says, "Hey, I have a medical condition. I'm allergic to something, or whatever." But on your phone, I know on iPhones. I don't know about all the Androids, but they have like your medical ID. You can go in there and you can put, if you're an organ donor, you can put emergency contacts. You can put what medications you take, what surgeries you've had, medical conditions, what medicines you need, your height, your weight. All of that, and you can access it. Any medical personnel can access it without knowing your passcode. So it's not something that you're going to have to open your phone for
it takes the
necessarily.
guesswork out of something.
Yeah.
It saves time, right?
Yeah, if you go to your little health app that has the heart on it, you can enter all that information in, and you can access it from your home screen.
That's fantastic.
Just like your emergency calls.
Connie, I'm out of time. It's always a pleasure having you on here because I know how busy you are and your work schedule's tight, and I appreciate you taking the time to come on out. And I'm sure everybody enjoys it based on the hits we got in the last one. I'm sure everybody's going to enjoy listening to this one too. Yeah. So I can't thank you enough. Ladies and gentlemen, we're going to take a break. And when we come back, we're going to have the awesome Mrs. Key, Cindy Key, Master Cindy Key from Central Texas Martial Arts Academy in Rockdale. See you on the other side. As always. Great.
Yeah.
Thank you very much.